Look behind the counter. Most front desks run on a shoestring, held together by overworked staff quietly seeking their next job. We tend to look at the base salary on payroll and assume that is the true cost of front office operations. That top-line number hides a massive structural leak. This graph tracks front office turnover. According to MGMA data, the departure rate hit 40% in 2022, 2 out of 5 people leaving yearly. Every departure penalizes Skuftis, costing $9,000 to $12,000 in recruiting, onboarding, and lost productivity. Medical practices are unwittingly funding a permanent, expensive training treadmill. This cycle actively drains operational capital without adding a single dollar of value to patient care. What happens to the staff who stay? They face a daily velocity of administrative tasks that simply outpaces human capacity. This chart breaks down how medical office staff actually spend a 40-hour workweek. A 2024 study by Google Cloud found that an enormous 85% segment is consumed purely by administrative work, long before they can engage meaningfully with a single patient. The immediate casualty of this time deficit is accuracy. When workflows are rushed, manual insurance verifications slip through the cracks, generating hours of follow-up work on claim denials. Overload also severely limits patient access. Even fully staffed desks miss critical incoming volume, with MGMA data indicating 30% of patient calls arrive after hours, when no one is answering. This funnel tracks the financial fallout of communication breakdowns. For an independent practice, patient no-shows accumulate into an estimated annual revenue loss of $150,000. Yet research shows 31.5% of these missed appointments happen purely due to a lack of effective provider communication. In-house teams fail because the modern healthcare system generates a volume of friction that exceeds the structural capacity of a human-only desk. When turnover and overhead are this high, the problem isn't the individual hire, it's the hiring model itself. Addressing this requires a shift away from the traditional, local-only staffing approach. Smart practices are adopting Staffingly. Instead of hiring another local receptionist, they integrate a dedicated, healthcare-specific offshore coordination team that stabilizes the front office function. This network map shows how the system eliminates traditional workflow friction. Staffingly operates as a central hub, integrating directly into your native EHR nodes, whether that is Epic, Athena, or eClinicalWorks, documenting every interaction in real time. The first layer of their intelligent automation is a smart routing system. It detects keywords and instantly directs incoming patient calls to the correct department, eliminating hold times and reducing average handle time. The second layer relies on insurance prediction algorithms. Before the patient arrives, the system proactively flags complex coverage issues and prior authorizations, so agents can resolve them long before they trigger a denial. Dedicated professionals utilize these AI tools to close the loop. Trained healthcare coordinators execute proactive, multi-touch reminder campaigns and manage empathetic patient check-ins that automation alone cannot provide. By layering intelligent automation on top of dedicated healthcare professionals, the practice builds a layer of operational continuity. This stabilizes the front office, protecting the practice from the volatility of the local labor market. A local hire's $35,000 base salary, after taxes, benefits, and turnover, stacks to a fully loaded $60,800. Staffingly delivers a trained equivalent for $21,600. This 64% reduction yields $39,200 saved per role. For a 3-person desk, that's $118,000 in annual savings. Implementation is rapid. The entire operational upgrade goes live in 48 to 72 hours, requiring absolutely no long-term contracts. The choice comes down to math. Decide to continue funding a broken, chaotic turnover cycle, or adopt a modern, highly profitable coordination architecture today.